Hi, it's Adrian from Advanced Dental Artistry. A common question we get asked is, isn't all-on-four bridge exactly the same as a denture but screwed in? They're actually very different. When we look at a denture, there's two parts of the denture that are not on the all-on-four bridge. One is actually this flange, and this flange actually covers just under the lip. And the reason for the flange is to really extend the denture so that it's more supported. The other very important area of a denture is actually the palate. And the palate, of course, this big seal, this goes around the entire upper part of the mouth. This is what actually gives the denture suction and support. So when saliva gets between the plastic or the acrylic and the gums, is that moisture actually forms suction, and that's what retains or gives the denture the retention. There's always problems with this, of course, because it takes up so much of the mouth that it does change usually the tongue position, and actually gets quite uncomfortable sometimes having it there. If it's extended too far, it can actually cause the patient to gag, and we normally find that patients do complain of altered taste because a lot of their palate, which does have taste buds on, is actually covered. When we look at the all-on-four bridge, it's very different. We try and keep the all-on-four bridge as narrow as possible, and this means that if we can, keep it about the same width as the teeth. The most important thing here though is the placement of the implants. The implants have to be placed very precisely so that the screw hole can actually exit just at the very top or the back of the front teeth. If this happens, we can keep the bridge very, very small, and it's really just the thickness of the bridge and a tiny bit of pink acrylic that replaces some of the missing gum in the bone. So when you look at both of these devices, the all-on-four bridge and the full denture, there is a huge difference in the size of them and naturally the comfort. And the last thing, of course, is the retention. One is actually removable, that of course comes in and out, and the retention of that really depends on the size. The bigger we make a denture, the better the retention, but the more uncomfortable it is. When we look at the all-on-four bridge though, it's the placement, the careful placement of the implants and the screws that actually hold it in place. But because it's such a narrow row of teeth, it is very comfortable for the patient because there's a lot of room for the tongue.